you are like me and you watch a lot of YouTube videos, there is this series of videos called What's in My Purse, and a lot of girls on the beauty channels and makeup channels, they do this. So I wanted to do a video that was what's in my nursing bag? What do I take to work with me? So it's probably not at all what you guys think, so I wanted to do it. Here's my nursing bag. It is just a Vera Wang princess bag that my husband brought the perfume for me for Valentine's Day, and he got the bag because he spent so much money. I don't even know what it is, but one of the most important things that I take with me everywhere I go is my clipboard. Y'all know I love my clipboard. I love my flow sheets. I take them with me. I use them. It's my brain right here. What is this? Another thing that I have, I haven't been in this nursing bag in a while. Okay, another thing I have is this. It's huge. It is like, it is the new orientation guide for this hospital that I have worked at, and it talks about all their policies. And of course, if you are starting a new job, or you need to know your patient's you need to know your hospital's policies. And I like this because it did show me like their IV pumps and how to use them, because there's 100 million different types of IV pumps. So also you have to know like who can do what medications you can give without a doctor's order, things like that. So I have this in here. I'm carrying on that thing. My stethoscope. And you guys might be really surprised about this stethoscope because it does look like it could have come from a Halloween costume kit. It's not very fancy, but I can hear stuff in this stethoscope that most people probably couldn't. And when I graduated from nursing school, I did have this fancy stethoscope. It cost me like almost $200, and I lost it. And I couldn't hear jack with it either, number one, but I lost it, and I said I wasn't never doing that again. So now I just use any kind of stethoscope because I'm pretty good at listening to heart sounds and lung sounds. Flow sheet. Another flow sheet. Magazines. Teen Vogue, because you gotta have Teen Vogue. And Marie Claire. 2 magazines. And I'm sure I got these from like the hospital waiting room. But here's the thing about it. I work night shift, and I don't care what nobody says. There is downtime. I have downtime, particularly because I'm really good at clustering care. I don't have to be in my patient's room 20 times a night, okay? I could be 4 o'clock in the morning, just done with all my charting, waiting for, the next thing, asking people if they want help, any kind of thing like that. Yes, or I could be reading a magazine. I try to really make sure I'm constantly busy, but sometimes you just have downtime. So I have magazines, and I'm not ashamed of that. What are these? Oh, this is the chest pain protocol for the unit that I work on, the hospital. Very important. I do cardiology. When somebody comes in with chest pain, I need to know, what do I have to do before I leave my shift? What is the expectation? Can I give medications without doctor's orders? Do I need to call somebody? Do I need to initiate something? So that's very important. I also take home flow sheets from my unit. And I don't do this every day, but I did do this because for this particular job, they had a lot. They were still paper documented, and it was a lot of stuff that you had to do for new admissions. And when I was a new nurse, I struggled with documentation. I really did, because I was under so much stress that I would not fill out everything. I would just try to document, and my preceptor would come back and be like, "Oh, Regina, look how much stuff you missed, and you didn't do this right." So to make it less stressful for me, I take these home. I look through them at my own leisure, because when you're stressed out, this is like, what do I do with all this? But if you can sit at home and look at it, you can get a feel for what it is you're expected to do. This will also help you with your nursing assessment. If you know that this form that your job uses is going to ask you, like, I don't even know. All this stuff is kind of simple, but if you know, like in particular, it's going to ask you like, what color is your patient's sputum or something like that. Is it beige or is it tan? Like, if it's going to make that distinction like this one does, it's important for you to know that when you're in the patient's room, okay? So you don't have to go in there 20 times trying to figure out, is their sputum beige or tan, which is the same thing. to me. So I take these home. I didn't do it always, but I did do it because this was a new unit I was working on, I think. More paperwork. I take paperwork home because I need to know. Flushes. I always come home with 1,000,000 flushes and also 1,000,000 alcohol wipes because I stuff them in my pockets and I forget about them. But these are very important. The flushes particularly because at the beginning of your shift, you need to be flushing your patient's IV to make sure it's patent and it's working, because you don't want to wait to the middle of your shift or the end of your shift for your patient to tell you, my IV is not working. Then you have to put one in, and that could be time consuming for new nurses. Like, it used to take me almost an hour to start an IV because I would be so nervous at first. Then I would have to get everything. Then I would get to the bedside and remember I didn't get everything. It was horrible. So I always have a lot of flushes in this. What is all this stuff? Junk. Highlighters. Also, what am I looking for? Oh, scissors. Very important to stick scissors in your pocket because I always find that whenever I'm in my patient's room, they need something cut. They want their dressing changed, or they want their something with scissors, and nobody ever has scissors in their room. So I always have a pair of surgical scissors or just regular scissors in my pocket to cut something. Oh, my winter gloves. I need those. I haven't been in this bag in a long time, obviously. Let me see. It's been a while since I used this bag. And then the rest of the stuff is my ID. So cute. Lotion. Lip chap. And I stuff this with food sometimes too, which I don't have in here. But this was in my nursing bag, so you guys kind of see what I bring to work. And I will see you guys soon. Bye-bye.